Hello everyone, myself Dr. Paritosh Baghel, consultant physician, Fortis S L Raheja Hospital. Today I am going to talk about what precautions one should take, what are the rules one should follow during the season of monsoons, especially those who have diabetes. So, as we all know, monsoons are nearby, and monsoon is a season which is associated with a lot of new things, fun, lot of things we think of. But at the same time, monsoons bring about a lot of diseases, and especially those people who have diabetes, they have to be extra cautious during this season. As we know, diabetes is a state of immunocompromised condition where a person is prone for minor to major infections. So they should be very, very vigilant about their health in this season. The 5 rules, which according to me are very, very important for any diabetic during monsoons, are: first, to keep yourself hydrated. Drinking water is a very, very important thing to remain healthy. In this rainy season, in the season of monsoons, generally the intake of water becomes less because you feel very less thirsty. So one should at least drink 2.5 liters of water daily, on a daily basis, to remain healthy, provided there is no contraindication for taking the water which is prescribed by your doctor if you have any kidney disease or if you have any heart disease. But otherwise, staying hydrated is the most important aspect, which I would ask all the diabetics to drink good amount of water during this season. The second rule which one should follow is to take care in terms of personal hygiene. That includes hygiene of hands, that includes hygiene of skin or the care of skin, foot care, very, very important. Once you get wet, there are chances that you may develop cracks in the foot's digital spaces. You may get infection, you may get cold, you may get respiratory infections, pneumonia. So one should be very careful during the monsoons in terms of that they should not get wet as much as possible to avoid getting wet. And in case if you have got wet, then make sure that you dry yourself, clean your feet and keep them dry. Avoid getting wet, and in case if you get any kind of symptoms, you have to immediately start consult a doctor and start treatment so that the infection doesn't progress further. Third thing which one should do is to have a good diet. So food hygiene is very, very important. Avoid anything which is uncooked, avoid outside food, eat as much as possible what you can cook at home, because in this season there are high chances of developing gastrointestinal infections. There are high chances of developing an infection from foodborne, from waterborne diseases in an organism. Also, wash any fruits and vegetables which you buy and bring at home. Wash them thoroughly so that you don't ingest any organisms and you get infected. Fourth fundamental rule which one should follow is to exercise daily. Now, during monsoons, because of the rains, one tends not to go out for exercise, and so I advise that all the patients who have got diabetes should exercise, do indoor exercises, stretch yourself, do yoga, because keeping healthy is very, very important, and exercise forms a major part to remain healthy. So doing exercises, continuing with the exercises during monsoons is another rule which one should follow. The last and one more important rule which I would want all the patients who have got diabetes to follow is to have a good nutritious diet. Diet is a very important part of remaining healthy. Have all sorts of fruits which are permitted in terms of your sugar. Have fruits, have vegetables, have a complete nutritious diet to remain healthy. Take multivitamins if it is required. If there is a deficiency, you should take multivitamins like vitamin D, which is very commonly deficient in our population throughout. So these are some of the rules which one should follow as a diabetic in these monsoons. Thank you.